Sherrie sat at a kitchen table buried completely under hospital billing statements. The savings accounts she and Michael had built across decades were entirely and completely gone. The grandchildren's college funds they had carefully set aside had already been fully liquidated. Just 2 years earlier, everything in their life looked exactly the way it should. Michael had retired from Consolidated Edison after decades of honest and completely reliable work. They had health insurance, retirement savings, and a quiet life carefully planned out in Virginia. They had done exactly what every financial advisor in America tells responsible people to do. So how does a careful, insured, responsible couple end up with absolutely nothing left? And what does their answer actually mean for the retirement you are currently building right now? This is the true documented story of what a single surgery cost in rural Virginia. By the end, you will understand something most fully insured Americans simply never see coming. Sherrie and Michael Foy spent their entire working lives playing carefully and faithfully by the rules. Michael worked for Consolidated Edison, New York City's largest and most established utility company. He was not in the boardroom, he was a reliable employee doing honest daily work. For decades, he showed up every day, did his job, and trusted the system around him. Sherrie contributed to their household, their savings, and their shared vision for the future. Both grew up understanding that saving consistently was simply what responsible, careful adults always did. They were not wealthy by any dramatic or visible definition of that word, but they were consistent, and in financial terms, consistency is its own kind of wealth. They contributed to retirement accounts for decades, every year without missing a single contribution. They even set up dedicated savings accounts specifically for their grandchildren's futures and educations. That was not a luxury to them, that was what responsible grandparents simply do. Their dream was not complicated, and it was not built on anyone else's money. When Michael finally retired, they did not celebrate with extravagance or dramatic gestures at all. They celebrated quietly, the way people who have truly earned something tend to celebrate. They chose southwestern Virginia, a stretch of rural land that felt nothing like New York. Sherrie had always loved animals, and the new property finally gave her room for horses. She built a small rescued horse operation, giving abandoned animals a second chance at life. Michael worked the land and cared for the property they had spent years imagining. Through Consolidated Edison's retiree plan, Michael still carried comprehensive health insurance into retirement. This was not a thin or basic policy, it was a real employer-backed retiree plan. They were the kind of couple who read the fine print every single year. By every reasonable standard, they were exactly the people insurance is designed to protect. Their children visited, their grandchildren played on the property, and their life felt genuinely full. Their retirement savings sat quietly in the background, exactly where those funds belonged. For two people who had worked so hard, this life was exactly what they deserved. It was simple, earned, and measured entirely by the years spent building it. And then, the way catastrophe always works, it arrived without any warning at all. Sherrie's body gave out in a way that no careful planning could have ever prevented. Her colon failed, and emergency surgery to save her life was simply not avoidable. This was not a lifestyle disease or the result of any negligence on her part. It was a medical emergency, the kind that simply arrives and does not ask permission. Sherrie and Michael trusted that their insurance would handle what came next after the surgery. They had paid premiums for decades. This moment was exactly what those premiums were for. Relieved, tender, Sherrie survived the surgery, and in those first days, survival was enough to hold on to. Then, the billing statements began arriving, and they arrived in amounts that made no sense. The numbers on those pages were so large that Michael read them more than once. Their insurance policy had a lifetime cap, a ceiling on total coverage it would pay. Sherrie's complications pushed the total bills past that ceiling by a catastrophic margin. The total cost of Sherrie's survival came to approximately $850,000. Sit with that number for just a moment before this story continues any further forward. $850,000 for a surgery she did not choose to need. Their insurance covered what it could, and then it reached its limit and simply stopped. What remained was now Sherrie and Michael's personal debt, and it was enormous beyond words. What happened next is the part of this story that most Americans never expect. The University of Virginia Health System filed a lawsuit against Sherrie and Michael Foy. The amount they were being sued for was $775,000. Not a corporation, not a hedge fund manager, just two retired Americans in rural Virginia. They had done nothing wrong, and a hospital was now pursuing them in court. To pay a bankruptcy attorney, they liquidated their remaining life insurance policy completely. Then they turned to the savings accounts they had set up for their grandchildren's education. Those accounts had been built with care, with hope, and with years of small contributions. Every dollar saved for the next generation was now redirected toward a hospital billing department. Quiet, respectful, leading into her own words. Sherrie later described what happened in 5 words that required no further explanation at all. She said simply, "They took everything we had, and now we have nothing." Those were not dramatic words. They were only the accurate truth spoken plainly and clearly. They filed for bankruptcy, the formal legal end of 30 years of disciplined financial building. This was not the end of reckless choices or failed investments or poor financial decisions. This was the end of a life built deliberately, carefully, and entirely within the rules. 1 surgery, 1 insurance cap, 1 lawsuit, 30 years of saving, completely and entirely gone. The horses, the land, the quiet Virginia life they had spent years building together, all of it became numbers, recorded not in years, but in outstanding medical debt. The Affordable Care Act of 2010 actually removed lifetime caps from most Americans' health insurance. But older retiree plans, employer-based legacy coverage, and grandfathered policies could still carry hidden caps. The Foy's plan fell into that category, technically compliant, but carrying limits they never anticipated. What erased their retirement was not bad behavior, it was a hidden system gap. Most Americans with health insurance do not know that such a coverage gap exists, and most will only discover it at exactly the moment when it is too late. There are 3 things inside this story that every American genuinely needs to understand right now. First, most health insurance policies in America contain a lifetime maximum coverage cap. Once your bills cross that ceiling, the insurance stops paying and you owe the rest. Most people have never asked their insurance provider what their own coverage cap actually is. Asking it before a crisis arrives could be the single most important financial question asked. Second, a general savings account is not the same as a dedicated medical emergency fund. Financial experts recommend holding at least $10,000 to $50,000 in liquid medical reserves. Most Americans lack that reserve, and most are 1 surgery away from financial ruin. Third, hospitals in America are legally permitted to sue patients who cannot pay their bills. The lawsuit typically arrives before bankruptcy protection can be established or finalized in court. The damage to credit, assets, and dignity begins the moment a hospital lawsuit is filed. Sherrie and Michael were not careless, they were simply unprotected against a system gap. That gap was not a mistake, it was simply built into the system itself. Understanding that difference between your mistake and the system's design is genuinely worth knowing. As of 2022, when this story was first reported, Sherrie and Michael had nothing left. The house, the savings, the grandchildren's funds, all discharged through a federal bankruptcy filing. Sherrie still spoke publicly because she believed this story needed to be heard by someone. She did not want their story buried where no one would ever read it again. She wanted other Americans to know that what destroyed them could destroy anyone at all. Not people who gambled recklessly, but people who saved carefully and trusted the system fully. In America, you do not have to make a single mistake to lose absolutely everything. Sometimes the only mistake was believing that doing everything right would keep you truly safe. If this story makes you read your own insurance policy tonight, please share it forward. Share it with someone who believes that having insurance means they are completely financially protected. If Sherrie and Michael weren't safe, the truth is, neither are you.